සුපිම්බර වෙසක් මාසයයි.
Prevention is better than cure. Good evening and welcome. This is Face the Nation. Our topic of discussion today is battling COVID-19 and the future course of action that needs to be taken. Joining us this evening on the show are Professor Untitled, former President of the Sri Lanka Medical Association, Professor Manoj Veerasinghe, Head Department of Community Medicine, Colombo University, Dr. Ashan Patrina, Registrar Community Medicine, Health Promotion Bureau. Let's start off tonight's show with Professor Manoj Veerasinghe, Head Department of Community Medicine, Colombo University. Professor Veerasinghe, as we are speaking right now, how grave is battling COVID-19 at present as far as Sri Lanka is concerned? Your time starts now.
First I have to say one word, because to the magnitude of the issue, all of us here are wearing face masks because we are indoors, to be an example to others to wear face masks, whether it's outdoors or indoors. So I'll start like that. Yes, if you look at the issues and the numbers that you see from Newsline and everywhere, you see from 20th of April onwards, now it's almost 20 days, you will see there is an increase of cases that have been detected across the country from about 150 by about 19th of April to about 2,700 up to yesterday. So it definitely shows the very high increase of cases, and on top of that you will see that there are deaths happening which you have not seen previously if you look at numbers. But I want to tell very clearly here that what you are seeing today is what the disease transmission happened almost 10 to 14. So you need to have that particular thing in your mind very clearly. What we are seeing today as cases or deaths is what the transmission status almost 10 to 14 days back. If you look at the transmission status today and the numbers that you detect today, then what exactly is to be seen will be seen possibly around 25th to 30th of May. So the magnitude I have explained in that way is very, very high. And it's a very difficult situation for the country that we are facing. And I am not trying to actually overemphasize it, but I have very clearly stated, looking at the first wave, if we are telling it's a wave, if we look at the second wave, and this third wave, if we are naming it, we are having a high number of cases and deaths.
Professor Veerasinghe, when you look at the numbers, when a mathematical calculation is being made with our country, with the neighboring country, India, people are of the view that Sri Lanka is as bad as India. Can you come or arrive at that mathematical calculation and say Sri Lanka's situation is as bad as India at present?
No, I'm not trying to compare it with India at all. For one very clear reason, our health system is much different than India's. So when you just cannot compare numbers or the rise of numbers and state the health situation is as India or some other country. Our public health preventive side is much stronger than most of the countries across. Therefore, we have to take and factor in that when we are considering where we stay. What I want to tell is the number increase is dramatic within last 2 weeks or 2.5 weeks. So it is an alarming situation. But I am not going at this moment to equate Sri Lanka situation to India, because India 60% plus healthcare is provided by private sector. If you look at Sri Lankan situation, In COVID, if you look at 95-98% of the treatment, quarantine, public health services are provided with the government, where there is a responsibility on that. It's just not private sector looking at. There is some contribution, but for that key reason, the difference of health systems, you cannot equate Sri Lankan situation today to India, or at least in the future. But the alarming thing is we are heading to somewhere we have never experienced before. That is exactly what I want to emphasize.
Professor Veerasinghe, you are speaking very articulating or very eloquently speaking about Sri Lanka's healthcare system, and saying that even the preventive action taken by the Sri Lankan healthcare authorities or healthcare workers is quite admirable. However, when you look at the numbers per se, it's quite evident that we were standing at around 150 persons 20 days ago, and now the number stands at 2,700 plus. The number of deaths experienced in the country at the moment is quite high. Given the fact, all these factors, do you think that the government should still rely on providing government or healthcare from the government in order to treat those who have been affected by COVID-19?
No, that's what I was very clearly stating. You need to understand the strengths of the Sri Lankan health system. Up to now, not just keep COVID out, but if you look at indoor patient capacity in the government and the provision of services to the government is almost 95% for in-ward patients. So that is a fact in this country. At the same time, we are giving private sector for those who can afford. We are very clear, private sector is not free. For those who can afford, there is a way to get treatment. But you need to understand a key thing. That is, when people, even in the private sector, get severe disease, majority of them up to now is been transferred to the government, because the capacity that we have in the government sector, we need to tell very clearly, is higher than of the private sector, because the consultant, human resources, nursing capacity in the centers that we have, at least 9 major hospitals that are catering to severe disease, is much higher than the private sector if you look at the human resource capacities and so on. So we have to actually look at the realities and the ground, and not only look at what is happening in other countries, because our system is much different to other systems.
Thank you very much, Professor Manoj Veerasinghe, Head Department of Community Medicine, Colombo University. I now move my attention to Professor Indika Karunatilaka, former President of the Sri Lanka Medical Association. Professor Indika, one of the most dire or pressing issues right now in Sri Lanka is the fact that those who got the first dose of vaccine, the Oxford AstraZeneca vaccine, are not being given the second dose as yet. Do you think in the coming few weeks the government will be able to secure the 600,000 plus Oxford AstraZeneca vaccine to the country, and make sure that 600,000 plus individuals will be vaccinated in the coming few weeks?
Yes, yeah, it's a question and the answer that depends on so many factors, especially if you think of the current situation in India and the crisis that is there. Then, because most of the vaccines that we have got, actually all the vaccines that we have got previously, that's the Covishield, the Indian production of AstraZeneca, was from the Serum Institute of India. But due to the current situation, there is a policy decision taken in India and not to import. And also with the situation that is changing and worsening in India, there is possibility that there will be some time that they will be starting importation of the vaccines to Sri Lanka and other countries. At the same time, now 2 other vaccines have been started after the National Medicinal Regulatory Authority approval as well as the WHO approval. That's the Sputnik and the Covishield. One thing we have to highlight is, or the mention is, vaccine is a very important tool in prevention of this condition or the epidemic, the pandemic control. Having said that, at the moment, like Professor Manoj Veerasinghe mentioned, at the moment there is a crisis in our hand and the patient numbers escalating and expected to get even worse in the coming days or weeks. So right now the priority is controlling, taking immediate measures to control the current situation. Because yes, vaccine is important and an important tool in prevention. However, one thing we need to realize is it will take time for the vaccine to take effect. For example, if we are to reach the levels of herd immunity, then the coverage of vaccine should reach at least 80-90%. That possibility is not a reality at the moment. It will take time. Even if the vaccination is taking place at the moment, for that also it might take some time. For example, for certain vaccines, even after the second dose is given, there will be time taken to develop the immunity. So right now, what I am thinking is, because we are in a crisis situation, Professor Manoj also very clearly mentioned, vaccination, yes, it should go on and it should continue and try to vaccinate as much as possible in a methodical and a rational way.
No, but do you think, Professor, that we have done that correctly? Because when it comes to streamlining the vaccination program and making sure those who got the first dose of the AstraZeneca vaccine are being given the vaccination for the second time, the second dose, that has not happened properly yet. Now the government is looking at mixing and matching, or probably a cocktail of vaccines as a second dose. Now, is this the way forward? Now, as an individual who is a professor in medicine, as well as the former president of the Sri Lanka Medical Association, do you recommend something of that sort to be given to 600,000 plus individuals who got the AstraZeneca vaccine first, mixing and matching and having a cocktail of vaccinations?
Yes. Again, what we have to say is, we have to go by the evidence. The decision should be evidence-based. So far, even though some research evidence is available related to mixing and giving vaccines, mixing and matching vaccines, there is no official recommendation from any of the official bodies, including WHO or Center for Disease Control in CDC or any other authoritative bodies, that you should mix and match vaccines, even though some countries practice that. So the same thing should apply to Sri Lanka also. Till we get the evidence and the official recommendation, we should not be going for that kind of measure. It has to be based on evidence.
So, Professor, what you're saying, in other words, just to make it very simple, right now there is no evidence with regard to mixing and matching vaccines with the first vaccine, first dose of vaccinations, and hence the government should exercise caution when vaccinating individuals with a second dose or probably a different vaccine altogether.
Agreed. I'm not saying there is no evidence. There is some research evidence, but there is no official recommendation related to mixing and matching. Yes, I agree with you. So right now, this is a crucial time point where the vaccine doses are not available. So again, the authorities need to decide what is the objective of vaccination. Is it to prevent the risk groups, or is it to prevent the spread? So at the moment, with the lack of the required doses for a larger coverage, then that decision has to be taken.
Professor, one quick question before I move to Dr. Ashan Patirina. What if we don't get the first dose of vaccine? The 600,000 plus individuals who got their first dose from AstraZeneca will not get the second dose. What will happen then?
Again, there is some evidence that even if you have got the first dose, there will be some immunity. Nobody really knows what would be the exact amount of immunity even after second dose, or how long it will last. But at the moment, there is some evidence that even if you have got the first dose, the immunity, some immunity will be there. So in that case, actually, having at least one dose is better than having nothing.
Right. Thank you very much, Professor Indi Karunathilaka, former president of the Sri Lanka Medical Association. I now move to Dr. Ashan Patirina, Registrar, Community Medicine, Health Promotion Bureau. Dr. Ashan, a few months ago when we had you on Face the Nation, you were very optimistic about the situation in Sri Lanka, and you said that the situation could be corrected if individuals start wearing a mask, washing their hands, maintaining social distance, stay at home as much as possible, and as a result of that, the numbers came down to around 150 persons infected with COVID-19 per day 20 days ago. However, now the number stands at a staggering 2,700 plus a day. How do you view the situation at present now?
Okay, Shamil, if we go back to that statement, the things that you just mentioned are still the most important things to do in terms of preventing the disease. So what happens is, if you really look at how the disease spread is taking place, it has not changed from the original virus, but the problem is that we did not stick to those guidelines. So a lot of discussions are going on about whether the new virus is different to the previous one. Is it going to give different symptoms? A lot of social media misinformation is going around about that. And on top of that, people are saying, okay, now this particular virus is airborne. Like, people do not even try to understand what do they mean by airborne. So there are a lot of things, Shamir, I think we will have to discuss as we go on. But for now, yes, things have changed, but that is to do with the shift of a different variant being introduced. So last time when we had the chat, like, it was not this variant that we were dealing with. So the number of the virus particles that are produced by this particular variant that we are dealing with, the major variant, is actually about 50% more infective than the previous one. So therefore it's spreading rapidly, and due to the high numbers, people are seeing more complicated ones. So in terms of virulence, whether it is actually causing more severe disease is yet to be established. It's just that due to the higher numbers, we are seeing more people in hospital. So yes, things have changed, but it's not that the way things work has changed. One thing is that we have not followed the protocols, so therefore there is a deviation, and this particular strain of the virus is actually more transmissible than the previous one. So those are the two factors that have changed up to now.
Dr. Ashan, we're talking about the Indian variant now. We're talking about the South African variant now. So are these the only variants that are present in Sri Lanka at the moment? And why is it so dangerous if that's the case?
Okay, so in terms of the variants, there are so many variants that have been detected, and this whole idea of giving names by the countries, I don't know like how correct it is, because these are the countries that have detected this strain, right? So they have the advanced facilities to detect it, and we actually give it the name based on the country that was detected. I don't think it's fair to do that. But then again, yes, we have detected the major strain that is circulating in Sri Lanka is the B.117 that was discussed. That it was there in the media, right? But the Indian variant, well, it's not found in the community, right? I think you're referring to the social media reports that have been circulating since yesterday about the Indian variant being detected. Yes, that has been an hospital report. According to what I saw on social media, it's not verified by the authorities. So you will have to verify it from the particular authorities that have detected it. But if you consider the major variant, yes, that is the B.117, yes, it's got a higher transmissibility, and we are dealing with that at the moment.
Dr. Ashan, I just want to touch a little bit about these variants before I move on to why the government is not moving towards a complete lockdown. B.117 variant, is that the Indian variant or is it something else?
No, it's not the Indian variant.
It's a UK.
Yeah, it's the one that was found in the UK.
Right, okay.
The Kent variant there.
Let's talk about why not the government put a complete lockdown, make sure Sri Lankans stay at home, because we know there are issues with the discipline of Sri Lankans per se, because even now we know that people are not wearing face masks, washing their hands, or even maintaining social distances, by the number of arrests that have been made by the law enforcement authorities in Sri Lanka, who are trying their best to enforce the law to make sure the spread of the virus is not rampant as expected. Why not go for a complete lockdown? What is the reason that the government is shying away?
Okay, Shamir, if you look at how this decision-making process is taking place, right, in Sri Lanka, we are the health sector that gives the technical inputs as to what we think. But the decision of closing down an economy or whether we are going to impose restrictions is a decision that needs to be made by the top authorities of the government. So for them to make that decision, the social aspect, the economic aspect, and various other facets of this problem needs to be analyzed. So yes, we have given our input on what we think is good. But when it comes to running the country, last time also I think Shamira explained that it's like running a company. Like you have your R&D department, you have your marketing department, then you have the accounting department, but you have a panel of experts right at the top who would make the best possible decision on behalf of the company. The same applies to us as well. So over here, like it's the government that has to make the call, but it's not as easy as what we think it is, right? Yes, we do have a difficult situation, but are we looking at a problem that we have to deal with for the next 2 weeks or 3 weeks? Probably not. This is something that we have to deal with for the next 2 to 3 years, probably, if it goes on like this.
I do not wish to take you on a political path, but I need to ask you this question because it does concern the people of Sri Lanka.
Yeah.
We just saw a few days ago, probably a week ago or so, when the Piliandala cluster was being spoken of, a strong minister of the government went ahead and lifted the lockdown. So if the government is not listening to the health authorities, what is the point of having such a government in play? Because at the end of the day, the people's health should reign supreme, isn't it?
Yeah, Shami. So that's the other thing. So we are focusing down on one particular incident that has gone out of track. When there are so many good things that have happened around the country, Shami, so yes, there are mishaps in every system. I don't say that it's just happening in Sri Lanka, probably in other countries as well. But the situation is that we are overemphasizing on this negative aspect, while we are overseeing some of the really good things that have been happening. That is not the situation that we are experiencing throughout the country, Shami. So this is just isolated one incident that is getting a lot of media attention. I think we are currently not experiencing something similar throughout the system. So if that is the case, we would be hearing more and more cases like that. But I think the beauty is the system is amending itself. Yeah, we are adjusting and
Ashan,
moving ahead.
It's individuals like you who come on national television and say from one person over 400 people could be affected, and if the government is not locking down a proper locality based on the number of persons infected or affected by COVID-19, what is the point of having such a system in play? So what is the role of the Health Promotion Bureau in a situation like that?
So Shami, like the good question is, that is if we do not stick to the protocols of disease prevention. See, this war cannot be done because there are 3 sectors involved in this. One is the doctors and the healthcare workers, the system, then the government and the people, right? So in this particular incident, like if we just expect, okay, if nobody really follows these disease prevention protocols, then yes, it can spread to 400. But we've been like continuously telling, because that's the only way out. We cannot shut down the country and keep it like that for the next 2 to 3 years. So
very quickly, Dr. Ashan, the University of Washington making an official statement in one of the media reports says that the number of deaths in Sri Lanka may or likely to increase to 20,000 by September, 4 months from now. Do you see that happening?
Yes, I saw that projection, and I think Professor Manoj gave the perfect answer for that. Without understanding how our system operates, how our resources are being aligned, and how our system responds to different situations, putting ourselves in a model that was developed for the USA and making predictions is highly invalid. Because see, somebody who understands how the system operates in Sri Lanka should do that projections, and I think Professor Manoj is one of those people who have actually done the projections for Sri Lanka based on our system. So those numbers would be very much different to what was projected in that Washington website.
Thank you very much, Dr. Ashan Pathirana, Registrar Community Medicine Health Promotion Bureau. We are in conversation with Dr. Ashan Pathirana, Professor Manoj Veerasinghe, and Professor Indika Karunathilaka. We're going for a short commercial break. When we come back, we have onto my right Jayamal Ratnayaka, as onto my left, immediate left, is Azra Hassan. So they'll be posing questions from a panelist later on in the show. Stay connected, stay with Face the Nation. We will be right back. Welcome back. This is Face the Nation. Our topic of discussion today is battling COVID-19 and the future course of action. I have opened the floor for journalists to pose questions to our panelists. Again, I want to introduce them to you. Jayama Ratnaka on to my immediate right, and on to my far left, or into my immediate left, is Azra San. So let's start off with Azra.
Yes, thank you, Shamir. I have a follow-up question from the conversation Shamir had with Dr. Ashan Patran earlier. I want to know Professor Indika Karunathilaka's opinion on this. Professor, now COVID-19 cases have been detected from all 25 districts in the country. Do you agree with the current way in which certain areas are being placed under isolation, or what do you think? Should we go into a complete lockdown?
Yes. Now, again, based on what we have discussed previously, the patient numbers are escalating, and the situation that we are seeing at the moment is actually what was there about maybe 2 weeks or even 1 month back. So what we can expect is, if the current situation continues, then the patient numbers would be increasing. Then what's the issue? The main issue here is, now previously we were discussing about the health system, and we have discussed that our health system so far has catered this situation. However, there is what we call the health system capacity. At the moment, the number of beds are being almost saturated. Similarly, the ICU and other facilities been saturated. And there may be a situation where our health system will find it difficult to cater for the ever increasing number of patients, and that might lead to a catastrophic situation even in a health system like Sri Lanka, and that is what we call a tipping position, where the situation goes into a complete chaos, and that might mean that even the service that we are providing at the moment will not be possible to provide longer.
Professor Karunathilaka, in your opinion, how far away are we from that chaotic situation? Are we being proactive also, especially when it comes to curbing the spread of the virus? Because in every media briefing or a program that we have on television, they always talk about preventing the contraction of the disease. But to prevent, you have to stop the spread of the disease.
Exactly,
So, yeah.
exactly. I certainly believe that we should have been more proactive, because there were information about the possibility of what is happening at the moment. For example, the UK variant was detected around March, and then the increase and then possibility of deviation from the practices at all levels was observed. So there should have been more proactive decision making, and maybe calls for movement restriction earlier than maybe 22nd of April, where the increase in numbers were starting to be directed. And like previously mentioned, what we are seeing is actually the situation that was there about 2 weeks ago. So we are 2 weeks behind that case. So certainly, yes, we need to be proactive. However, now there is not much point of going back into what has gone wrong or what was not done. At the moment, we are in a real crisis situation, and the current situation, today's situation, might be appearing in another 2 weeks' time. So what is meant by being proactive at this situation is preventing the health system going into further catastrophic situation. For that, I think we need to go for an immediate action that will prevent transmission or the spread of the epidemic. In that case, from the technical point of view, there may be a justification of at least 2 weeks lockdown, at least in the district level, because at the moment the lockdown that is happening might not be efficient to prevent a crisis of this nature.
So, Professor Indika made a very valid point. Professor Manoj Veerasinghe says that the lockdown or isolation that is adopted by the government at present is not going to be sufficient to combat the spread of the virus. Why is it that the government is still shying away from imposing a complete lockdown, Professor Manoj? What is the reason behind this?
Can I get a couple of minutes to explain a basic fact, which is not really explained in most of the media or conversations?
Yes, please.
This is a communicable disease where this disease is transmitted from one person to other by an agent, which is the SARS-CoV-2 virus. And there are three elements you have to look in if you are going to control this transmission. What we call the host. Host is the man who is getting the disease. Then there is the agent, which is the SARS-CoV-2 virus. And the third is the environment where this transaction occurs. This is a basic principle in controlling communicable diseases. We have to have interventions on all three places. If you look at the agent, we do not have a drug at the moment to kill the agent. There is nothing that can kill the SARS-CoV virus as a drug. So that is out. Second one is the host. Host, what we are having at the moment is vaccination, and from vaccination we are trying to protect him by increasing his immunity, and secondly by asking them to have precautionary measures of mask, hand washing and so on. And the third one is the environment where people meet, people gather, and they actually transmit the disease. So what you are looking at of movement restriction is trying to actually intervene in that particular transaction of agent or the virus getting from one person to the other. So when we are looking at all three, if you look at the vaccination process, it will take at least, for my personal understanding, at least 7, 8 or 9 months to get our population fully vaccinated, to get that herd immunity which was mentioned earlier, and that is a medium to long term prevention strategy. As you have correctly stated, then what are we going to do about this particular issue of transmission from person to person? There is one of the key things is to restrict movement of people, thereby reduce the exposure to the virus from one person to other. That is where what you are stating, this lockdown comes. This lockdown word is a bit of a scary word for different people in different ways. Actually the industrial community, the business community look at it, they find it's a real killer for the economy. If you look at majority of at least the 60% of people in this country who does not get monthly salaries, they will find it very difficult to sustain. So with all these things looked at, we have to look at what is the best option at this particular moment.
So what is the best option?
Yes, I agree. Looking at the current situation of transmission, as an epidemiologist and a person who is in the community, I definitely advocate high level of mobility restriction at this moment, because the transmission that happens now will be visible only in 2 weeks' time. Looking at the numbers in the ground at the moment, yes, we need to restrict movement at least for 2 incubation period. Why we are calling incubation period? SARS 1 incubation period is over 14 days. At least if we can restrict that mobility for 14 days, then we could restrict the current transmission cycles within next 14 days to a minimum level, which means we will still see high numbers coming for next 12 to 14 days, but after that we expect the numbers to go to a peak and reduce. This is the actual technical guidance. So as you say, yes, I believe there should be a restricted movement, but how we do it is the question. Are we going to do an island-wide lockdown? Is it necessary? Or are we going for a night curfew? Are we going for a weekend curfew? Or are we going to do certain other restrictions? For example, few things have already done. One is reducing the mobility of school children, where 4.2 million are school children. They are at home. So 1/4 of the country is at home. If you look at the teacher population, other workers in school, and the parents who will go with children, it's almost more than that are at home. So that is one way of restriction. Second one, the officers, government and others have been asked to limit 1/3 of to work at a given time, which means there will be less crowded buses, less crowded transport. Therefore, we have restricted for some extent mobility. But if that is not adequate, then we have to go more.
But that seems to be non-adequate. The problem is Professor Manoj, right now the numbers have been increasing.
That is
the numbers
exactly
were 1,500 3 days ago. The
No,
numbers
that is exactly
stood
what
at
I'm telling you.
2,000
What you are
subsequently.
seeing-
Now the number stands at 2,700. And
No.
the government is not taking any action about it, thinking that the country's economy should reign supreme over people's health. Isn't that unfortunate?
No, that's what I am answering. What you seeing numbers now are the numbers which happened almost 2 weeks back. It is not the numbers what all these precautions were taken. After that, we do not know what will happen in 10 days time. But I still believe there should be more restrictions applied, at least restrictions at provincial or district levels to movement. That has to be definitely come. Night curfew, weekend curfew, and if still it does not work, we may have to reduce mobility by large area lockdowns, maybe provinces, or if nothing happens, country. But to do that, there are other elements that government or anyone want to look. So final message to your question, yes, there should be increased restrictions of movement applied now if we are going to reduce transmission and cases in 14 days to 20 days time. If we do not do those things now, we will have very large numbers in 14 to 20 days. So lockdown, in the way you define it, we may have to think, the government have to think very clearly, when are we taking this decision to at least to lock down or restrict movement in major provinces with major transmissions at the moment. What I propose is at least western and northwestern and at least no railway districts and a few other districts, there should be some real restrictions coming in at this particular moment.
Dr. Patirana, if I may direct my question to you first concerning the vaccination drive that is currently underway in Sri Lanka. We know that nearly 900,000 people were inoculated with the first jab of the AstraZeneca vaccine, and the second jab is also impending, and other people were inoculated with the Sputnik and so on. If I may ask you this, because there is a general misconception, I feel personally in society, that if one does get the first dose of the vaccine, or in fact even the second dose, that they are fully immune from the virus, and they tend to become complacent and ignore wearing a face mask or following proper health guidelines, doctor. So can you apprise the people of whether they are fully shielded from this variant or from the virus as a whole once they are inoculated with either the first dose or the second dose?
Thank you, Jamal. So that question, I think we've discussed that this type of vaccine is not providing what we refer to as sterilization immunity. There are some vaccines that provide sterilization immunity, where if you take the vaccine, the chances of you getting that particular disease is zero. But there, even in the past, like the polio vaccine, which does not provide sterilization immunity, but if enough numbers are vaccinated, we can still stop the disease. So the thing is, this is not providing sterilization immunity, but it does provide you with some protection that will protect you against severe disease. But that's provided that the disease does not undergo a major mutation. But that does not mean that you will not get the disease. We have seen more than enough people getting the disease after the vaccination. But yes, there is some protection. But if somebody thinks that you have just taken the vaccine and that you're almost immortal or immune to this virus, we are sadly mistaken. You have to follow all preventive protocols till everyone is vaccinated. I think the WHO nicely put it together. Nobody is safe until everyone is safe. So you have to make sure. So even in the world, if one country thinks that they can vaccinate their people and that they will be safe, well, they are also sadly mistaken. A mutation might happen in another country and it will come again to them. So taking the vaccine, yes, it provides you with some cover, but it's not going to make you immortal or completely immune to the virus.
So, doctor, staying on the same topic now, we know that there are multiple variants, the B1617, the B117 and so on. Do these vaccines, any form of vaccine, the Sinopharm or the Sputnik or the AstraZeneca, do these provide protection against all these variants or only the initial variant that was identified?
Yeah, so the protection is there for all variants, but there are reductions in particular some strains. The effectiveness of the virus through research have shown to be a little less, but that does not mean there is any reason for us to have doubt about the quality of the vaccines. These vaccines are good. They are already preventive, because we are going by a number called effectiveness right now, which is something that is difficult to interpret across the board, because this research by different companies have been done under different circumstances. It's not something that you can just put on the board and compare, okay, this is this much, the other one is this much. So when you look at those numbers, some of the vaccines were trialed in areas where these mutant variants were available. Still, it was good, right? It doesn't mean that it's not good, but the effectiveness might be a little less than for the original virus. So vaccination, yes, that's a go ahead. We have to use the vaccination. Might be in some countries they're considering whether a third dose that will cover the mutant variants is necessary, but that's something for the future. Right now, vaccine, yes, is the way forward, but it will take a long time. As Professor Indika Karunatilaka mentioned, you will have to stick to all the other protocols while the vaccination is completed, and a day comes where we will have herd immunity and the disease spread will be minimum.
Professor Karunatilaka, if I may direct my next question to you. You agreed a short while ago that we are in this crisis because of somewhat poor COVID-19 management by the authorities. And certain quarters have come forward to say that the people in fact became complacent during either the months of February and March leading up to the new year, and that caused a spike in COVID-19 cases now. Do you believe that the authorities are doing enough now to develop the health infrastructure in terms of bringing down ventilators and more oxygen cylinders and ICU beds and so on, Professor?
Okay, very interesting question, because there's a lot of focus on ICU beds, and now a lot of concern whether the ICU beds are adequate. There is some saying there are 700, 800 ICU beds in Sri Lanka, and some saying about 109 or so. The current reality is the number of ICUs that are dedicated and used and identified for COVID is around 109. And out of those also, at the moment, that is actually used is even less. And those ICUs are almost reaching capacity. So there is a lot of concerns about the adequacy of ICUs and ICU beds. One thing we have to mention is that developing ICU capacity is not something that you can do overnight or within short time period, because it is not only about having a bed, which is also rather sophisticated, but it would include other monitoring mechanisms, equipments, trained staff, and the spacing and the ventilation, so many other factors. So therefore, developing the capacity is not easy. Even if by some reason, if we develop the capacity by larger numbers, even then, if you think about the number of increase in patients and a percentage, certain percentage, like about 5% of patients might need ICU care. So that's a percentage basis. In that case, even if you increase the number of ICUs, within very short time, it will be saturated. So actually, the focus, if we are to prevent the health system breakdown, I think the focus should be on preventing the patients reaching the level that they need ICU care. That is very important.
Professor Karunatilaka, true that there was concern about the ICU adequacy in the country as well, but what about the oxygen supply in the country?
Okay, yeah.
Especially after seeing what's currently happening in India, we can't simply forget that this could be our future. What kind of measures are we taking in that particular area?
Very correct. It is not only oxygen actually. I mean, if I may say, what the health system and what we should focus is preventing the patients getting into the situation that they need the ICU care. There, what is most important is identifying the people, identify the patients who will move into that level, and detecting and providing early management, where oxygen is also important. But more than that, it is very important the early detection and early management of the patient. Again, I will give one example. In the past, most of the intermediate care centers are functioning as isolation centers only, mainly. During that time period, it was okay because most of the patients were actually asymptomatic, but not anymore. Due to the large numbers, now there are so many patients who are presenting, they have symptoms. And again, with those large numbers, there is higher possibility that a a percentage, maybe 5% or even more, moving to that level. So it is very important to detect those at the earlier stages, because once you reach the level of ventilators, you mentioned the adequacy of ventilators, once you reach the level of needing a ventilator, that is almost point of no return. So it's very important at this moment that we provide the facilities for the intermediate centers and other primary care level centers, the adequate facilities for monitoring. For example, simple monitoring like oxygen saturation has to be there. It is there in the guidelines, but because of the difficulties, logistical issues, manpower, all these areas, the health system is almost exhausted. So those things may not be happening in the way it should have been happening.
Professor
So,
Veerasinghe, if I may interrupt you for a second, Professor Karunathilaka. Professor Veerasinghe, when must someone resort to taking a PCR test? When must he or she take a PCR test?
It's a bit of a complex question you are asking. First thing that we need to tell is that if at this particular moment, if you are having a respiratory issue, symptom, and if you are having basically the general symptoms that we are talking about, then with the symptoms you should report to a hospital as quickly as possible. So if you go
when
to
you say general symptoms, what are these general symptoms?
general symptoms, there is fever, there is respiratory cough and actually cough. Then people get a bit of influenza like feeling tiredness. Then very clear symptoms are that you don't get the perception of smell and so on, and taste, and those what we find is they occur more frequently now in patients that our physicians see, and if you should not delay and you should report to a hospital, to a doctor, that they will evaluate you and decide whether this is similar with the general symptoms of COVID. Therefore you need to go to a test. And
so when must someone decide whether they should stay at home and take medication for COVID-19, or they must visit a hospital and take medication for the infection in question?
Very clear, as I told you. If you get those symptoms, best thing to consult a doctor, because what we see now, those who come late have complications developed by the time they reach a facility, and it makes extremely difficult for the health team to intervene.
So Professor, I just want to clear some air here. So when I spoke to several infected persons who were staying at government care centers and also private hotels that were managed by private hospitals in Colombo, what they were saying was they were not given any medication. They were only given vitamin D, vitamin C, as well as Panadines. I don't know how far these are true because I'm not a doctor myself to comment on it. But I'm talking about the second-hand information that I have received. So if they are getting the vitamin C, the vitamin D, and the Panadines or the Panadol or the paracetamol for that matter, why must they go to a government hospital if that is the case?
Very clear. You never know when the next symptom appears. Next symptom, what I mean is, we see for about 25% plus of the infected at the moment get somewhat symptoms, and particularly issues of respiratory nature, and they develop to breathing difficulties in no time. So if we have any symptom, if you wait at home, and then you will be alerted only when you feel you find difficult to breathe.
So are you trying to say, Professor, that anyone who is tested positive for COVID-19 should go to a government care center or a private hotel or a hospital managed by the private sector hospital authorities if they are to make sure that they are okay? So yes, home quarantine is out of the question at the moment. Is that what you're trying to say?
Yes, I have very clearly stated it in several forums and I have given recommendations on that. looking at the new variant, looking at the symptomatology that we are seeing of the patients for last about 1 month period, we clearly see it is not safe for a COVID patient to stay at home, because you never know when you will get worsening symptoms.
Right. So,
that
Dr.
is
Ashan,
very seen.
So, Dr. Ashan, interestingly, Professor Manoj is of the opinion that it is not safe for COVID patients to be staying at home and get treatment as experienced in other parts of the world, but in particular, may it be the US, may it be Kuwait, may it be the Gulf countries, may it be the UK for that matter. So that is out of the question at the moment. If that is the case, does the government, as Azra and Jayamal pointed out, do we have the right infrastructure at the moment? We know a few days ago the army constructed 10,000 beds for the benefit of patients. However, if you look at the numbers that are coming out from now, those beds are only sufficient for 5 more days only, if we're talking about 2,000 plus individuals who are going to be infected with COVID-19. So do we have the necessary infrastructure in place?
Yeah, so as I said, we are talking about the best case scenario. Right now, we do have the infrastructure. While we are having it, there is no reason why a person who could be monitored by health professionals should be staying at home. Say, Shamir, what we have to realize is we are hoping that we will be able to cope with it, but if it comes to a point where we will have to go to other measures when the numbers exceed, as Professor Indika mentioned, a tipping point where the available resources are overwhelmed by the number of patients, well, at that point we can consider other options. But right now, while the infrastructure is available, there is no point putting anyone in danger, because it's a risk benefit ratio that works in this regard. But Professor Manoj explained is that right now we do have the resources. In that particular scenario, if somebody thinks that they can stay at home, and if they can't catch the drop in saturation, right, and because it's kind of difficult to catch, it's a little tricky with that, but they say is that, you know, like the happy hypoxia sets in, like, you know, you act as if your saturation is good and that your breathing difficulty is not there, but eventually you go into a sudden like, you know, difficulty in breathing. So we do not want that to happen. And yes, based on the current resources, it's best that you consult a doctor in the hospital. They will make the best possible decision on your behalf.
Right.
Can I add one point, please? Just to add what Ashan said, already there are a bit of a backlog, you know, at the moment, and there are people who try to wait at home. Every day, what I understand, at least 300 to 400 calls comes in the night for sudden evacuations for those who have not been cleared to the hospitals on time. So which means it's a serious issue.
Just getting into how people should attend or visit the hospitals. Let's say someone in Colombo gets a respiratory disorder because they have been infected with COVID-19, but they have not been able to find that cause out yet because the PCR test has not been conducted yet.
Yeah.
What is prudent for them to do? Is it to go to a government hospital or to go to a private hospital to take immediate attention or medical treatment?
Okay, so the most important thing is you have to isolate yourself. So if you think that you have symptoms that are suggestive of COVID, you need to isolate yourself and make sure that the people inside your house are not getting affected. And when it comes to transport, right, either you visit your family physician or you visit a government hospital, what's important is that a qualified person assess you. So that needs to be done. But when you're doing that, you cannot use public transport and put other people at risk. So you need to be creative. You need to find some help where someone who can wear the full PPE and, like, you know, have all the precautionary measures, take you to one of these places, and a qualified medical person makes the best judgment on your behalf.
Dr. Pathirana, just a second, Shamir. Dr. Pathirana, another expectant mother died owing to COVID-19 today. Do we have a separate set of guidelines that especially the pregnant mothers can follow when it comes to being safe against the COVID-19 pandemic?
Yes, Azra. I think from the Health Promotion Bureau and the Family Health Bureau, we put out a set of guidelines about 3 days ago. It's available on our social media platforms as well as the web. And so what we are basically saying is, yes, the pregnant mothers have a higher risk of catching it, and then in terms of the mothers not coming to the clinic is giving us a bigger concern, because pregnancy is a risk period, and that's why we have the mothers coming visiting us at the clinics regularly. If that doesn't happen, that can actually give rise to worse situations. So the hospitals are equipped to handle the mothers in a safe environment. So yes, you have to be careful. The full guideline is quite lengthy, I won't go into details. But the key message is, yes, the pregnant women are at risk, but not visiting the clinic or getting the proper medical care is even more harmful. So you have to follow the guidelines that have been given. Simple things: wear the mask, wash your hands, don't touch your face, nose or mouth or eyes, right? And when you visit these places, try to make it as brief as possible. Open air spaces are much better than closed environments, right? So you follow these protocols. While doing that, get the proper medical care. So if you want the full set of guidelines, it's already available.
Dr. Ashan Patrina, getting back into what I was discussing about before, Azza spoke about the expectant mothers. My question is, let's say someone gets infected with COVID-19 while they're at home, any part of the country, maybe in some nook and cranny, that they are not able to go to a doctor immediately. What should be the first step that they take?
Well, as I said earlier, the first step is to isolate yourself.
Right. So isolating yourself. Let's say they do a PCR test. If that PCR test is going to come in within 2 to 3 days, as experienced now through a government laboratory, then what must they do?
Okay. So during that time, yes, make sure that you don't give it to anyone else. But at the same time, if you think that you are developing any symptoms that Professor Manu just explained, a shortness of breath, if you can't take 3 or 10 steps and you are feeling breathless and you think that you have advanced disease, that doesn't mean you are going to wait, because it's a medical condition. If somebody can't breathe and you are breathless, you are not going to stay at home just because COVID is not the only disease that we are having in this country right now. There are people developing heart attacks, there are people who develop strokes, the dengue is again coming up, leptospirosis is there. There are so many other reasons. So in that particular situation, well, we have a hotline available, 1999 from the Health Promotion Bureau, where a medical doctor will pick your calls 24/7 in all 3 languages. You can call them and get your medical advice, and they will direct you to the best possible scenario. So just waiting is not going to help if you develop complications.
Right. So when someone dials 1999, they can contact a physician and get medical advice. Is that what you're trying to say, Dr. Shah?
Yes, it's a MBBS qualified doctor who will answer you in all 3 languages, whatever your preference is.
So the number to dial if in an emergency is 1999, and there will be an MBBS qualified doctor who will answer your call, whether it be in Sinhalese, English or Tamil. So Professor, I want to speak a little bit about the vaccines that are in play at the moment, but we have to go in for a short commercial break. Because of those reasons, I'm going to leave the discussion momentarily with a full stop for the moment. We will be right back to discuss about battling COVID-19 and the future course of action. Stay connected, stay with Face the Nation. We will be right back. Welcome back. We are now moving on to Indika Karunatilaka, former president of the Sri Lanka Medical Association. Professor Karunatilaka, interestingly, we saw today the government has contracted with the Pfizer Institute to get down the Pfizer vaccinations required for the country at the moment. However, what we are not looking at is whether we have the necessary infrastructure to bring these vaccines to the country and then administer them to the people in question. Does the government have those facilities? Does the healthcare sector in Sri Lanka have refrigerators that can keep these vaccines for 93 Celsius or 93 Fahrenheit below?
Yes, it is a challenge. I mean, the facilities are available, but not to the extent that would require for a mass vaccination like this. So in that case, I mean, the other vaccines that Sri Lanka has been using would be more kind of amenable and logistically feasible for the country's situation.
So my next question to you is, Professor Indika Karunatilaka, is about the Sinopharm vaccine that is right now in present and is being administered to the people. With the little bit of knowledge we have about China is the fact that evidence is not available as predicted in terms of how to make sure that the vaccination has been successful in China because of the democratic flow of information, the non-democratic flow of information that is prevalent in China at present. So how did the WHO give the nod for that vaccine in question?
Yes, so basically this is not a normal situation. So how WHO or any other authority gives the approval is for the emergency use. So that is different from the procedure that you follow for giving the approval for the routine use. So considering this crisis situation, the approval was given for emergency use by the NMRA as well as the WHO. How they usually do is they have to go by the available evidence. So here also they had to take the decision based on the documents supplied by the producer.
Well, I want to ask you a very direct question, Professor. I know you're also a lecturer at several medical institutes in Sri Lanka as well, and you're also a qualified doctor. And my question to you is very direct. I want you to be as direct as possible. If you are given the option to get a vaccine, what is the vaccine that you would take and why? Is it the Pfizer? Is it the AstraZeneca, or is it the Sinopharm or the Sputnik?
Yes, considering the current Sri Lankan context and the facilities, I would go for AstraZeneca with the current available data and the evidence and the information that is available. However, the current situation is a crisis where the vaccines are not available and in very short supply. I think we have to be fair by the government also, which are trying to address this issue of the lack of vaccines and doses and trying to find different measures to address this issue. So this may not be the ideal situation. This might not be the ideal situation, but with the situation that is there, I believe if there is a vaccine that is approved by the authorities, better to have a vaccine rather than not having a vaccine.
No, because initially we know, Professor, how the Sinopharm vaccine came to Sri Lanka was the fact that it was brought to the country to only administer it to the Chinese nationals in the country, and none, and not Sri Lankans. And suddenly, all of a sudden, the WHO approves the Sinopharm vaccination, and just a few hours later, the NMRA agrees to the vaccine for emergency use as well. So I'm trying to figure out, was there any political tug of war? Because we know the geopolitical situation right now in Sri Lanka is quite alarming. We are swaying a little bit more towards the Chinese at present. As a result of that, we saw how the Chinese ambassador in Sri Lanka tweeting as a response to a Sri Lankan national had already said that they are even looking at establishing a vaccination center jointly with the Sri Lankan government as well as the Chinese government. Why not think differently, or why not dream big? That was the exact tweet from the Chinese officials. So was there any geopolitical tug of war in this equation where the NMRA suddenly decided to approve the Sinopharm vaccine?
Yeah. I think the key word here is again emergency use, because this is a crisis situation and the key word is emergency use. In an emergency use, then you have to follow certain procedures that are different. But still WHO has to go through the documents. NMRA has to go through the documents, and the documents is obviously has to be provided by the producer of the vaccine, and they have, so what they have decided that the current vaccine and the document that have been provided is in line with the requirements for the emergency use. We cannot say it's the ideal situation, but the key word here is the emergency use. So I don't think it is anything related to say geopolitical issues or politics or whatever. It is one option that had to be taken due to the current crisis situation.
So, Professor Manoj Veerasinghe, Head of Department of Community Medicine, Colombo University, what we have realized is, Professor, most of the people who were wearing a mask, who were washing their hands constantly, and who were maintaining social distance for a great extent, we've not been able to be behind them and see whether they've been doing this or not, have also been infected with the virus. So how important is it to stay at home and attend to your work from home, Professor Veerasinghe?
Yes, it's a very good question. We assume people wear masks correctly. We assume that people wash their hands regularly, and we assume that they keep distance all the time. So that is the issue. If we go back to 2 months and see, did we actually practice it? If you go to a supermarket or store today, you will see only a given number of people are admitted to the supermarket or the store. When the death numbers rise, when the case numbers rise. But this was the same virus, same disease which has been there for 14 months in this country. But did everyone practice in that way? That is the major question. If you get out of your house 4 weeks back, looking at the New Year season and so on, I don't need to elaborate on how things happen. What we are seeing now is what happened in the month of April.
Professor Veerasinghe, what kind of measures should the authorities take, especially when it comes to the upcoming Ramazan festival? What kind of measures, Professor Veerasinghe, should the authorities take, especially when it comes to the upcoming Ramazan festival in the country? If we don't be proactive now, there's a high chance that we will go back to making the same mistakes we did during the Audutsav time.
Yeah, I would couple Ramazan with Vesak, which will be coming on 2 weeks' time. Whatever the occasion, this is not time to do things in the way we used to do things. This is a time where there's an emergency, there's a pandemic, and we need to look at it from a spiritual angle and not as a celebrating festival. So whether it's Ramazan or whether it's in Vesak or later in Poson in the next month, I think the same rules should apply. Go through your spiritual, whatever the belief that you have. Do not organize gatherings. Do not go to gatherings even if they are organized. Make sure you are protected. When everyone thinks I am going to be protected, the whole community is going to be protected. That is one. Second, there is a huge role from the law enforcement. We have a Quarantine Act which is 124 years old. 104 years old Act. At that time, very clearly stated, these are things that need to be done in a time of pandemic. We are not asking anything, just enforce the Act.
Professor Karunatilaka, if I may, Professor Karunatilaka, if I may direct my question to you. Now, there is a national emergency or a crisis thereof regarding COVID-19, and it has been so for the past 14 months. But we know that the health system of Sri Lanka does not only treat COVID-19 patients. There were and there continue to be other patients suffering from acute illnesses, diseases, and so on. How equipped or well equipped is our healthcare system to manage COVID-19 patients or treatments, and also the other patients who require the necessary treatment, and how well are the authorities faring with ensuring the well-being of non-COVID-19 patients or patients suffering from other sorts of diseases, Professor?
Yes, that again can be an issue. One advantage Sri Lanka having is the Sri Lankan health system is very much geared for the prevention and basically catering for mainly like non-communicable diseases. That could be the main issue, the non-communicable diseases, in addition to the current crisis that we are having. So I think this is a matter of identifying what are the priorities, what are the services that we need to maintain. So there are many areas that are included. One area would be the human resource management. Now, the human resources is a finite number, it's a limited number. So how can we make sure that the available human resources are utilized, human resources in health are utilized in such a way that the COVID services are maintained while other essential health services. There may be certain areas where the non-essential services has to be identified. Some of the non-essential activities has to be identified and prioritized. That has to happen. So that's a matter of, say, prioritization, what are the services that we need to continue. Then identifying who are the health professionals and what is the amount of human resources that are required. Then what is the amount of other resources like the equipments and the medicines that are required. So this is a time period that really calls for a real coordination within the health system. So it is not only the pandemic, it's not only identification, there are other areas also. And that also make it so important that the pandemic situation is also controlled very well. For example, if you don't prevent patients reaching into levels that are requiring, say, higher level ICU care or more complicated care, we will be draining on the already drained and kind of a limited health system and resources. So that is why, like we have mentioned previously, monitoring at field level and monitoring. That is why monitoring at the intermediate care centers and other primary care is very important. It is not the drugs that you provide. It is not that. Is what is important is monitor and identify early. Because like Dr. Ashan mentioned, the silent hypoxia, where the people will be suddenly getting into bad situation and pneumonia and then reaching into a point of no return. That has to be detected early. That kind of detection will actually save lot of resources that can be used for other areas and other services, and we should be able to maintain that. But if we couldn't prevent that, what will happen is all these things will drain from the other resources. So in that way, we will not be able to maintain not only the routine services or even the essential services, even the COVID situation, COVID treatment and management will also suffer. So therefore, proper human resource management is very important, prioritization is very important, and then streamlining the early detection and management so that we contain this, we manage this situation in a way that it will not drain any further resources. That is why the proper human resource management, proper hospital management at primary care is very important. That should be the focus.
Yeah, Dr. Ashan Patrina, Registrar of the Community Medicine Healthcare Promotion Bureau. What is the message you have for Sri Lankans at the moment, Dr. Ashan, especially coming in from the Health Promotion Bureau?
Yeah, so Shamir, like what we need to practice right now is, as mentioned correctly, like the enforcement of these things. Now, when we walked in here today, Professor Manoj nicely explained that we insisted that we wear the masks today and continue this. And yes, we were given the opportunity, so the environment facilitated, you allowed us to do that. So people have to be empowered. If somebody is hindering another person's protection, people need to be empowered to understand that you have a right to ensure that your safety. So at the same time, we want to have people more involved in this particular scenario where people expect others to follow this thing as well, because see, sometimes people don't have the the courage to even tell someone, like even the security guards we've seen are completely powerless sometimes. When somebody walks in without a mask, they just allow. So that sort of things need to go away, because just giving health education is not sufficient anymore. There needs to be a little bit of community mobilization and empowerment where people do take good choices. Even if your wedding was planned and that you've been dreaming of this wedding for the last few years or your entire lifetime, but this is the time for you to change. So people need to make good, solid choices, and we need to empower them to do that.
So Dr. Ashan, while you're talking about weddings, I was having a grin on my face because I have a friend who's getting married, and unfortunately because of COVID-19 he had to push off his wedding by a few more weeks. So that is acting responsibly, I would say. Dr. Ashan, now social media is doing the rounds about wearing 2 surgical masks, not one. Is this necessary?
Yeah. So, Shamira, the thing about this whole airborne spread, right? So that's where this thing about 2 masks have come into play to provide more airway protection. So this people have misunderstood it. Like when we say airborne spread, we think that it goes through the air currents and it just goes in the air and somebody breathes in the air and then they get it. No, this happens because the viral load has now increased with this new strain. The virus has not changed. It's not like, you know, earlier it was droplet based, now it's all of a sudden airborne. No, now there are higher number of virus particles that are suspended in air in a closed environment. That is the reason why we insisted that we wear masks today. So yes, if you want complete protection from an airborne pathogen, yes, you will have to find a higher level, but more than 2 masks, 3 masks would do. But then again, you can't go on like that. The best thing to do is make your visits to these confined spaces as short as possible, and make sure that there are less people in that environment. If you can open up the windows and ventilate it, that's even better. But if you can't provide all that, and if you think that you need better filtration, yes, you can go for 2 masks. But try to find ways where you can mitigate this without, really troubling yourself too much. But it is proven that wearing 2 masks is better than 1. That's common sense, I guess.
Yeah. So Dr. Pathrana, also we know that when you go to a private hospital or a private institution or any other institution for that matter in Sri Lanka at present, they check your temperature.
Yeah.
Is this an effective tool to nab those who are infected with COVID-19, or is it just a practice that was adopted a few months ago, but it is now continuing as a result of that same trend that has been adopted before?
Yeah, so the first thing is to check whether these equipment are actually working. Right, so I mean, we are yet to come across someone who's saying that okay, they were caught in a found to be having high temperature at a supermarket or some other place and not allowed to come in. But that's the first thing, to see whether it is being done properly. And as Sir correctly mentioned, the disease symptoms have not changed. Fever is one of the prominent signs of COVID. So yes, that is just one layer of it. So the other part has to come from the people to be responsible. And if you are having a dry cough, shortness of breath, like a sore throat, anything that indicates that you might be having COVID, it's best to stay at home. We are just using one layer of that protection.
So again, Dr. Ashan, now you're giving some mixed signals here.
Yeah.
Are you saying if there is someone who is having a sore throat, who's having mild respiratory ailments, who's having fever, must they stay at home?
Yeah.
Or must they do a PCR test?
They have to stay at home and then go to one of the medical practitioners who are qualified to provide care. I think we discussed that previously, Shamin. So the moment that you think that you might be having the symptoms, either in the government sector or your private doctor, make sure that you get the proper advice and get yourself evaluated before you go out to the public.
Right. So the steps that need to be followed is, first of all, isolate yourself, meet your medical practitioner, maybe someone from the government or the private sector, and then based on what he's saying, do the PCR test and then admit yourself to a government care facility or a private care facility.
Absolutely. And if you are in any doubt, you always have the hotline where you can get assistance from a doctor.
Right. Dr. Ashan, with regard to having the necessary infrastructure to transport patients from one point to another point, ambulance services, we know several years ago, thanks to a then politician, I don't want to mention name because today we're not talking about anything related to politics, because of the far-sighted way in which a politician thought, we got the 1909 ambulance service in Sri Lanka. Do you think we have the required ambulances in the country to take patients from one end to another, or are we seeing a lack on those as well? Of those as well? There
is a constraint in the resources, but I think you all saw that like new vehicles have been pumped into the system, just like the hospital system. Yes, the whole system is put under stress, but we are trying to manage it in the best possible scenario. But in those cases, that's why I said, like, you can't ask for an ambulance to go from home to see a doctor. So in that particular scenario, you will have to be creative, make sure that if you have own transport, like use that while ensuring the person who's transporting you does not catch the disease. So that's why
it was an alarming number that Professor Indika Karunathilake brought to the table before when he spoke about the number of ICU beds, responding to a question posed by Jaimat. He said there are approximately around 700 to 800 beds in the island, out of which only 100 plus beds can be utilized for COVID patients at present, because all the other beds are utilized by other non-communicable diseases patients who probably have paralysis or heart ailments or open heart surgery, so on and so forth. So this number is quite alarming when you say 100 plus beds only for COVID patients. Now that puts all of us into limbo, isn't it?
So yeah, those are the facilities that are available in the designated hospitals for COVID management. So that is a decision that is been renewed almost every week to decide whether we are going to take new facilities into the system. So as Sir said, the problem is not just having ICU beds, but if you allow somebody to go into the ICU and probably get ventilated, well, the chances are pretty bad. So our main task is to stop that from happening. So getting people through to that point. There's a lot we can do to prevent people getting into ICU. So if we do our job properly, and people follow us and help us in this, we can prevent people coming into ICUs. Even today we are having about 15,000 to 16,000 people in hospital management, and only a handful require support. So what we have to do is, yes, we do have a shortage. That does not mean that there can't be more hospitals taken in to manage COVID patients, but are we doing it at the expense of other people who require care as well? So these are the decisions that are being made at the top, right? The pros and cons are being weighed in. But as Sir said, just because we come and put in ICU beds doesn't mean the staff is going to just appear from somewhere, right? We need to have trained staff. The equipment needs to be there. ICU is not the same as some building. The ventilation system has to be designed in a certain way. So all these things need to be thought through before.
Dr. Ashan, have you got the second jab?
Yes, I have actually got the second jab.
One of the lucky people who got the second jab.
Well, yes, we were lucky. But then again, as I said, having a vaccine is much better than not having a vaccine. So, and this whole concept of mix and match and everything is coming out, but and the research that was done by the Sri Lanka University showed that people who got the jab, the AstraZeneca, the first dose, had a better seroconversion and immune response than people who actually got the disease itself.
Right.
Sometimes.
Right. So Dr. Ashan, do you think that if you are, because you are a qualified doctor, if you are given an alternative second dose, would you have taken it?
Yes, if the evidence is backing it, and because Professor Indika nicely explained, because you have to go by the evidence. There are some countries, not some countries who would just practice voodoo medicine, but Germany, France, even Canada, right? Even in England, at the very onset last year, they offered Pfizer and AstraZeneca together. That is without having the hard evidence to from a regulatory authority. So based on the situation, yes, people will have to make choices. And in France and Germany, if I'm not mistaken, they're offering people who took the first dose AstraZeneca to take Moderna or Pfizer.
So then if that is the case, Dr. Ashan, why is it that almost, if we speak to 100 doctors, at least 90 of them would have difference of opinion?
Well,
and that puts a fear on the mindset of a person who goes to take a second jab.
Yes,
isn't that the problem? At least all the doctors have to unite and say in one voice as to what has to be done.
I think the best person to answer that would be Professor Manoj. Yeah.
Can I answer that? I think I was waiting to answer a question like this. If you look at, there are 3 levels when you are managing a crisis, and for anything. There is a policy level that we need to put certain inputs into that level to take policy decisions. There is a technical and an operational level where people have to talk to that level to take that decision. And there is another level which is the public and awareness of public, which we are supporting now. I think as professionals, basically we need to understand where we should put things straight at these 3 levels. And if we are going to talk about severe policy business into public, And if 10 people are going to go and talk about 10 different aspects to the public get misled. Same thing. So when you are looking at a technical decision, the technical people who are better aware will finally brainstorm and come to a decision. At a policy level, those things would be weighed and look at the other consequences and will take a decision. But when people are going for the media and trying to look at things that need to be discussed at policy level and technical level and try to discuss it at the open level, where different people will take different take-home messages from the discussion, where they are not experts to evaluate and see what is the best.
So I am not
that
talking
is
about
exactly happening now.
Professor, I'm not talking about experts. I'm not talking about ordinary people who are making comments, but experts who are making comments in their respect. We saw several days ago from the Sri Lanka Consultant Doctors Association, one of their representatives said it's important for the government to have home quarantine regulations for those infected with COVID-19. However, you are having a difference of opinion on that. Then the same doctor said that quarantine has to happen at 3 stages. One at home quarantine, then at the care centers, and then comes hospitals to make sure that we don't overcrowd hospitals. However, you have a difference of opinion on that as well. You are saying that it's important to give healthcare, the government healthcare service to all those who are infected with COVID-19. So we are not talking about ordinary people. We are talking about individuals who are responsible, just like you, just like the representative from the Consultant Doctors Association in Sri Lanka.
That is exactly I am telling. What I am telling, I was trying to put across is there are certain things which we need to have a consensus a certain way, and a general there is a consensus now. Because of these issues, as I very clearly stated earlier, because of the new variant and the symptomatic and the possibility of sudden hypoxic coming, there is a serious data coming now that it's not good to keep people at home. That is what I was expressing from the question that was derived. But I'm talking about the variants and some of the efficacies of the vaccines and so on. The general public, when we are going to talk in detail on those, they find it extremely difficult to digest and they take different messages home.
Yeah, so the problem is, Professor, there is difference of opinions in your fraternity as well, unfortunately, amongst the doctors about how they're looking at things. The Government Medical Officers Association looks at the problem completely differently. The Department of Community Medicine representing the Columbia University is looking at it differently. The Registrar of Community Medicine Health Promotion Bureau, at least the 3 of you are on the same pedestal as to how people should be treated. But if we had an opposing view, they would have a complete different of opinion at this very stage, and that confuses the people. And as a result of that, the people are thinking that the government has not taken any proactive measures to get them vaccinated for the 2nd dose.
Shamir, can I add to
yes, Professor. Yes.
What Professor Manoj was telling? I am also in full agreement with him. Again, I would look at from a different angle. Now, there may be a resource issue, whether our facilities are adequate for ever increasing number of patients. Then there could be a human resource issue. Do we have enough doctors? Are they fatigued, infected? Are they sufficient? The numbers sufficient? Then about this discussion about the home management. So we are looking at 3 issues. The decision for home management is a clinical decision policy. It's a clinical decision policy. It has to be made based on clinical decisions as a policy. But the human resource issue is another one. So we should not be making clinical management policy decisions based on human resource issues. Those has to be addressed separately. If we have a human resource issue, then we have to look at the current numbers of doctors and other health professionals and see how we can manage this most effectively. If we need additional support like maybe medical students and other resources or volunteers, do we need that? That decision has to be catered separately. Then if there is an issue related to the resources available in the hospitals, that too also has to be coordinated and collaborated in that way. If there is a need for, say, the home management, that's a clinical management policy decision. At the moment, that was mentioned very clearly, there is a very clear need for proper monitoring, because the proper monitoring and early detection will definitely, there is a lot of evidence coming from intermediate care centers that if you can detect patients early and start simple early treatment, as simple as say providing say IV steroids, or maybe sometimes oxygen, or positioning, or hydration, strict bed rest. With those early measures which can be implemented even at a low resource setting, there is evidence that you can prevent patients moving into stages where you need ICU care. So that would be an area where you can basically safeguard a lot of resources and proper management. That is why proper management has to be there. Those facilities has to be provided into those centers. Human resource issue has to be managed separately, and the logistic issue has to be managed separately. If there is a decision for home management, that has to be a clinical person decision. At the moment, the concern is because of this risk for the silent hypoxia, you have to monitor. And the current situation, the facilities for monitoring at home or at field in Sri Lanka is very minimal. That's the issue.
Thank you, Professor Karunatilaka. If I'm to direct my question to...
One question for Azra.
My final question, Shamir, to Dr. Pathirana. Dr. Ashan, now what is extremely clear to us is that it is the health authorities, those who are actively engaged in the health sector, the qualified doctors and the professors, who have to give the proper direction to the policy making, decision making authorities in the country. Are you, can we be, I won't ask if you are satisfied, but can the general public be satisfied with the amount of information the decision making authorities are obtaining from the health authorities, and about how much they comply with those directions?
Yeah, so at the end of the day, one person who is actually engaged with the policy making decision is Professor Manoj. And you can see what you see on media is a yes or no decision. Whether you're going ahead with this vaccine or this vaccine, whether you're giving approval, yes or no answer. But the amount of work that goes behind the scenes of cutting through the data, trying to see what is the best possible vaccine, considering our logistics and everything, it's not so simple, right? So many experts have different opinions. That's the beauty of it. That's the beauty of science. You don't just take one person's opinion and say that this is the universal truth of it. These are all experts in their own fields, and all their inputs are taken in and debated over, and a final outcome is received. Then based on that, other people can criticize, just like how different opinions exist. They do happen, but believe me, a lot of work is going behind the scenes to make these decisions. So just like what you said, that all of a sudden when the WHO approved the Sinopharm, like the NMRA gave approval. I think if you go to the pretext, the NMRA said we will approve the Sinopharm the moment WHO provides the clarification, because WHO have access to things that we do not have access to. So it clearly said before the approval that once the WHO approval is given, the NMRA will give approval. It didn't happen all of a sudden. So right, likewise, you have to understand a lot of work goes behind the scenes in order to make this yes or no decisions. Thank
you very much, Dr. Ashan, Professor Manju and Professor Indika. We now go in for the final round. Each speaker would get 3 minutes each to wrap up. We start off the final round with Dr. Ashan Pathirana, Registrar Community Medicine, Health Promotion Bureau, on the future course of action in terms of fighting COVID-19 in Sri Lanka is concerned. The time starts now.
Okay. So as I said earlier, this is the time for people to start getting involved. Don't expect others to keep you safe. So we have got used to this, paternalistic type of care where you expect the system and other people to look after you, but you have to understand there's a lot that you can do by yourself, right? And the other thing is about the positive. Shamin said how his friend made a conscious decision to postpone his wedding. These things do not get highlighted enough. We see a lot of negativity on media saying this guy violated this and this guy didn't stick to it. Yes, but just because someone else violated it doesn't mean that going by that rule you're also going to go and violate it. But we need to bring out the positivity of, there are so many people like Shamin's friend who have made good conscious decisions for the betterment of the society. We need to bring out that positivism if we get together. It's the same people who are able to dose the second wave, as you call it. right? It's through good practices. It's not through lockdowns or anything, and we were able to maintain it. When the D614G mutation came up, we also had another outbreak, but then again we controlled it. The same could be done here. But we need people to come on board with us. Yes, the system will try its best to provide the environment to facilitate it, but even in that absence, I'm saying to the people of this country, let's do it. We have done this before, let's do it again.
Thank you very much, Dr. Ashan Patrina, Registrar Community Medicine Health Promotion Bureau, Professor Manoj Virasinghe, Head, Department of Community Medicine, Colombo University.
Yes, 2 or 3 things. First one, yes, we are in a critical juncture on this pandemic in this country. We expect numbers to go up. We expect more people to get infected, and definitely with that we expect more deaths to happen. Therefore, every one of us have a duty. The government has its responsibility to make the maximum to protect the people, detect, treat, and get them well. On the other hand, all of us with this increase in numbers will be exposed to this, and there is very high chance that any one of you listening to this could be getting an exposure in next couple of days or next 2 or 3 weeks. So it's our duty to make sure that we take the maximum precautions to get out of this. That is the first thing. I am not going to detail. Second one is, I think, extremely important. Please make sure you do not get distracted by sideways. We find there are so many distractions coming time to time in this country. Whenever something comes, somebody comes and tells something, particularly of a cure for a treatment or something, and people are going and flocking on those places, endangering their lives and taking unnecessary assurance that you will be safe. I think there is no guarantee of safety till all of us are going to be safe. So everyone individually find it very difficult to say that I am safe. That is the second thing. So don't get carried away by distraction. Third one, this is a time for us to get together and face this. And it is not a time just pointing fingers and blaming and having quarrels. I think if we go in that line, all of us will be in extreme danger. So this is the time for all the country to get together and face this for next 1.5 to 2 months to get out of things safely. Thank you.
Thank you very much, Professor Manoj Virasinghe. Professor Indika Karunatilaka, former president of the Sri Lanka Medical Association.
Yes, thank you. Short-term measures as well as long-term measures. So all of us accept that currently we are in a crisis situation. So the immediate short-term measure is to bring this into control, and all of us having responsibilities. All our responsibility, the main responsibility is to strict adherence to the preventive measures, because whatever the strain is, whatever the vaccine is, whatever the changes are, the preventive measures haven't changed. What is more important is, if the situation is becoming even more serious, we have to more stringently adhere to the preventive measures. Preventive measures of isolation, quarantine, cleanliness, physical distancing, they have to be adhered to even more stringently. And also the current crisis situation, the decision makers' responsibility to make sure that the health system is not overwhelmed. The current situation is brought to control immediately with strict implementation of movement restriction, and also making sure that the current health system is not overwhelmed with proper facilities for monitoring, early management, early detection, and addressing the human resource as well as the other logistical issues. Long term, no kind of uncertainty about that. We have to adhere to preventive measures. There is no ambiguity. We have to adhere to preventive measures. We have to move towards a new normal. That's the only way out. Thank you.
Thank you very much, Professor Indika Karunatilaka. Thank you very much, Dr. Ashan Patrina, Registrar Community Medicine Health Promotion Bureau, for joining us this evening, along with Professor Manoj Virasinghe, Head, Department of Community Medicine, Colombo University, Professor Indika Karunatilaka, former president of the Sri Lanka Medical Association. Thank you very much, gentlemen, for joining us this evening, despite there is an imminent threat to even your lives, being in a closed environment, and however, taking into account that there is a need for the public to know exactly what is going on in the country and what sort of action should be taken by them in order to combat COVID-19. Thank you very much, Jayamal, and thank you very much, Azra, for joining us this evening as well. We are guilty of not wearing our masks today, but that is complete to make sure that there is clarity in what we are saying and clarity in our voices to make sure that we deliver the right message to you. So today, this morning, when I was doing my rounds, usual rounds on social media, I saw this particular quote that struck me. It says, when the time comes, we have to go. For those individuals who think that they don't need to wear a mask, wash their hands or maintain social distance, I tell them, do not be selfish. You are not only putting your life at risk, but also those who are living around you. Your loved ones are at risk as well. I leave you tonight with a quote, as I always do. Trust your Lord, but tie your camel. Meaning, trusting the Lord is good enough. However, you have to make sure that you tie your camel when you are in a desert. So make sure that you wear your mask, you wash your hands and maintain social distancing, and most importantly, stay at home as much as possible. These are dire times for Sri Lanka, hence your safety is top priority. Take care and good night.
සංවර පින්ස්වර ඇසෙනා සුපිම්බර වෙසක් මාසයයි.